I am the disabled guy with the disabled life. That podcast is going to be about disabled issues and other things that interest me and others from the disabled community. I did this so that people understand what we go through in life and what we do, because a lot of what we do, it is interesting. I'm also going to talk a little bit about ADA and things of that nature. It's something that's very important to me and something that I learned a lot about when I did an episode. I'm going to talk more about it. Okay. This podcast, it's going to come out at 10 p.m. Saturday and Wednesday. So that's when that's when I think most people listen. Most people listen at night or have the episodes there for during for the daytime. So okay, now let me talk about something that I find is very important. This piece of advice applies only to those of us that are mentally capable of making our own medical decisions. Advocate for yourself because it's really important. Sometimes parents want to assist. Let them assist. I don't mind if they assist. For example, with me, when I go to the doctor, I let my parents in and I talk, but I'm the one that takes control and talks to the doctors and with their. Sometimes I'll ask them, is this something you agree with? And they say yes. Yeah, they've always said yes, but I've always asked them. I don't keep things from anybody. Maybe friends that are not close, but family and friends that are close. No. I don't keep anything because I want that. I want those lines of communication open. For example, I had to have I had to have radiation for cancer that I had, which was prostate cancer, and that's what I did. I talked to them, and they said yes. So that's important, really. But think and talk to your doctors, and remember, the doctors that help you. He's there, or she is there to do. In conjunction with you, it is good to talk to them and have a good relationship with them. But if you feel that the doctor isn't helping you, or let me give you another one. If now let me explain something. Now that I'm out of prostate. Now that I'm out of radiation treatment, they still follow me once a year, I think it is. Okay, but they're doing what they call telemedicine. There was one guy that I was talking to on the phone. It was impossible. I say it was impossible. I'm not going to say who, where, when, what. It was impossible. It was so. He would ask a question and not let me formulate an answer. And being that I'm disabled, he was giving me advice that I could not follow because no, we can't follow that advice because of my disability. But he wouldn't even let me talk about that. That's an example of bad as a doctor. So what I did to handle that situation, I handled it by saying, okay, no. I called I think it was a personnel manager, somebody like that. And I told her, this is what's going on. I don't like it. Please don't send a doctor and don't have that doctor call me no more. I've never had that experience, but that's a way to advocate for that. I'm going to talk more about my radiation experience as a disabled person because it's going to be interesting to you. And I just wanted to do this so that I could talk about this one and have you understand what I was going through. I'm okay now. I am still in some treatment, but No more radiation. Everything is okay. But I'm going to talk about that. So I'm going to talk about that thing because that thing to me is important for you guys to hear about it. And but my advice here is advocate, 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 and talk to your doctors. And if you don't like something that's going on, speak up. You're the patient. You speak up. You're the patient. And if they want to listen to you, if they listen to you, fine. If they don't, if they don't, go somewhere else. But luckily, I've had good experiences with all my doctors. Not one, except for that one person that I got rid of. But it's okay. Things happen. I say okay. It's okay. Things happen. We have to do what we have to do. With that, I'm ending season 7 soon, and I'm gonna go to season 8 soon. I don't know exactly what day I'm gonna do that, but I am. So yeah, keep it in mind. Advocate, advocate, advocate. It is important because who is gonna take care of you? You and your doctors and your family assists when you're able to. You're able to do things. Make your own decisions. Yes, do that because it's really important that you do so. I really feel that. I say again, I really feel that the doctors I've had have been good for me, even though sometimes one or two is not something I want. Oh, another thing I'm gonna say: if a student comes in and you're not comfortable with that, talk to the doctor, and you don't have to accept that. You can tell him or her, hey, I'm not comfortable with being alone with this person. And it shouldn't offend anybody. Or you could ask him or her to stay and let him do his job, but make sure he or she, make sure that that's a good case. I don't mind. But, but if you're not comfortable, have him stay. With that, thank you for listening. Thank you for listening to my episodes. My episodes will come out Monday and Wednesday. You can listen to me on Apple Podcast, Spotify, and many others, including iHeartRadio. The reason I've done this podcast is to give people a voice. Because I think that the disabled community is missing a voice, but I am in a unique position of being able to afford minimal equipment to do this. I'm going to give you my email address. My email, if you want to contact me, is ke4key@gmail.com. And I will also, you can also follow me on Twitter, Facebook, at The Disabled Guy, and a few other places where I put my episodes out on Facebook too. With that, thank you for listening.